The suboccipital muscles. The suboccipital muscle group is composed of 4 very small muscles that are found at the junction of the upper cervical spine and the skull. We have the obliquus capitis superior, obliquus capitis inferior, rectus capitis posterior minor, and rectus capitis posterior major. This muscle group functions to make small positional adjustments between the skull, atlas, and axis. Here are the landmarks for the suboccipital muscles. We have the occiput, or base of the skull, the atlas, also known as C1, and the axis, also known as C2. Contraction of the muscles in the suboccipital group controls the movement, flexion, and extension of the head on the neck and the rotation of C1 on C2. Some of the muscles in the posterior cervical muscle group assist the suboccipitals, and the muscles within the group, the suboccipital group, oppose each other. Clinical findings for the suboccipital muscle group. Clients may complain of pain in the temple, side of the head, and behind the ear regions. They may also complain of diffuse pain that seems to penetrate deep inside the skull. And trigger point-induced tension in these muscles can cause restriction in head rotation. Some factors that may activate or perpetuate trigger points in the suboccipital muscle group include prolonged looking upward or to the side, forward head posture, use of bifocal glasses, automobile accidents, and chilling of the muscle. Trigger points in the posterior cervical group are associated with trigger points in the suboccipital groups, and the referred pain from the trapezius trigger points can activate trigger points in the suboccipital muscle group. Some common misdiagnoses for active trigger points in the suboccipital muscle group include atlantoaxial or C1, C2 joint instability or restriction, tension headache, migraine headaches, and cluster headaches. To locate and release the suboccipital trigger points, start with the client in the supine position. Ask them to raise their head as you slide your hands underneath it. Now have the client lower their head into your palms. Your fingertips should be contacting the region just below the base of the skull or the occiput. Gently turn their head to one side so that it rests in the palm of your hand on that side. Be careful not to cover their ear as you do this. The trigger points lie just below the occiput and about halfway between the mastoid process and the midline of the upper neck. They refer pain to the temple, the side of the head, and above the eye. Using 2 straight fingers, apply pressure to the trigger points. The angle of this pressure should be towards the client's nose. Hold the pressure for 6 to 8 seconds and repeat 4 times. You can enhance the effectiveness of this release by asking your client to retract their chin as you apply pressure. Aid their movement with your supporting hand. Alternatively, you may use your thumb to apply pressure to the trigger point. With the client supine, ask them to pick their head up off the table and place your hands just under the base of the skull. Now you're going to have them turn their head to one side and rest it in the palm of your hand, and locate the suboccipital trigger point just below and behind the mastoid process. Starting at neutral, turn their head to one side. Be sure not to cup their ear, and apply pressure with your fingertips towards your client's nose. Turn the head, apply the pressure with your fingertips, Remember to use client feedback because this can be a sensitive area. Hold the pressure 4 to 6 seconds and repeat 4 times.